raise awareness of diabetes as a global public health issue and what needs to be done as well, collectively and individually, for better prevention, diagnosis, and of course management of the condition. Now, this World Diabetes Day, the World Health Organization will highlight the need for equitable access to essential care, including raising awareness of ways people with diabetes can minimize their risk of complications. The activities will also celebrate the experiences of people with all forms of diabetes to help those impacted to take action, including seeking and obtaining essential care. Now, we are very happy to welcome our special guest in the studio. That is Dr. Nqobile Mhlongo. Good morning and welcome to Urban Woman. Well, I can say welcome back, but welcome to being live in the studio with me today.
Thank you, and good morning to the listeners. I was actually just laughing just before getting to the studio that I saw a Facebook pop-up that was saying that on this day we had an interview exactly 5 years ago.
Oh, wow.
Same studio.
Look at that,
It's been so long, hey?
Time just flies and it feels like yesterday. Well, that's fantastic, Dr. Mhlongo. Now, today is World Diabetes Day and we'll be looking at type 1, which is actually common in children. And I think many of us didn't know that. So thank you for your time in coming to educate us. But I think let's jump into it. We heard of diabetes, but maybe you can just elaborate and tell us exactly what it is, how it affects our body, and also specifically type 1 diabetes.
Type 1 diabetes, as you have highlighted, is common in children. So anybody below the age of 12 is considered as a child medically. And it's called insulin-dependent diabetes. And we know that in diabetes, there is a problem with regulating the blood sugar. And the hormone insulin is very involved in the management or the control of blood sugar so that cells in the body can optimize, blood sugar glucose for just, your normal body functioning. But when we say there's diabetes, there's absolutely little or no insulin at all that is produced in the pancreas. So we find that commonly in children.
Right. So indeed, it is the pancreas then that is not obviously functioning at its optimal. But now, how would you say type 1 diabetes can then be diagnosed?
Commonly in children, we unfortunately see them in a very critical condition. The commonest presentation for children is when they would collapse, or like children who are very sick with infections, and they normally present with an acute medical condition known as DKA, diabetic ketoacidosis. So you find that these children would be well and normal, without maybe a push or a precipitating infection until they have like a precipitating infection. Then it pushes their body to stress and, increased body glucose requirements would actually make these children to present. They'll be very ill, with fever, signs of infection, and sometimes they may be unconscious. Sometimes they may even have seizures, So usually these are very sick children, and they are usually, referred to the pediatrician or even admitted to ICU. So that's when we do further tests where we can be able to pick up that, actually these children have diabetes, and specifically type 1, where we check the urine, in the children. And classically, children with DKA will have ketones in the urine, which is basically meaning that the body is now trying to break down proteins to help the patient to survive.
Okay, so some of the symptoms that we can look at is like if the child is very sick and basically having concussions. Anything else parents can be on the lookout for?
So like you say, feeds, children that are feeding, it's important to always exclude diabetes. But generally, children that are unwell, children that are not putting on weight, children that have recurrent infections, sometimes, if it's just a mild infection, they would recover from that. But you find that the underlying problem is actually diabetes. And we know that diabetes is so linked with the immune system. So that's why you'd find that these children are just chronically ill.
Okay, just to remind listeners, we are live on Facebook at the moment if you want to see Dr. Mhlongo in the studio with us. And of course, if you have any questions, if you have a child maybe that does have type 1 diabetes, you're welcome to drop us your message as well. Now, doctor, is type 1 diabetes transferred from mom to baby? And if it is so, then is there a way for mothers to actually avoid it during pregnancy?
Type 1 diabetes is actually intrinsic, which means that if the child has the condition, it's just purely with the child. Or if the mother has the condition, it's purely with the mother. However, from a genetic view, one who has a family history of diabetes, even type 1, has a likelihood of developing the diabetes. So it's not an infectious disease, which is meaning that it is transmitted via the blood that that the baby is obviously feeding from the mom's blood, but from a genetic standing. So that means even if it's the dad who has type 1 diabetes, because the child carries both the mom and the dad's genes, they are likely to be born with the condition
and pick it up. Absolutely.
Yes.
How can parents better manage then type 1 diabetes in their children?
It is important to say that it's a very challenging medical condition, especially with children, because, we've seen how, as adults, we just fail blatantly in the management of diabetes because it involves food.
Sure.
So food is a social thing. We eat, whenever families gather together, we eat, and birthdays and all this. So you can imagine a child who's told not to eat sweets or like sugary stuff and sweets, and the families still want to invite this child to parties and all that. So it is quite challenging for children and for parents as well. Like you can imagine having to prepare lunch every day for this child, and I am a mother of 4 as well. So just the infection at the crèches that children are transmitting from one another. So you can imagine a child who's already immunocompromised, and the mother has to work or the dad has to work, and they have to place this child at a crèche where they are just prone to infection, where they will be sick every second week. So importantly, it's a team management between the doctors and the mother. So we would say parents are actively involved with the management of the child, and also the child themselves. It's very important for parents to educate the children as early and as young as possible, so that they can actually understand the condition, and they can then understand why they are told not to eat certain things, and they are told, if the other child has a Kit Kat, and why this particular child cannot. And also just involving a dietitian, because they can assist families to actually make home like a homemade ice cream for these children, because at the end of the day they are children and they still want to express themselves as children, and they love all this treats. My kids call it treats. It's a Friday treat. So if it's a Friday treats, it may be very difficult for a parent with diabetes, with a child that suffers with diabetes, but an involvement of a qualified professional dietitian would actually assist this families so much just at home as to how they can actually have nice and goodies that are substitutes and healthy for their kids.
You've just put such a spotlight on the reality of children with type 1 diabetes, because let's think about it. Which child doesn't love sweets? And everywhere they go, think about it, people just shove sweets in their hands. So it's so important to bring that awareness, and of course it's challenging. What are some of the risk factors, if you can tell us, of type 1 diabetes?
So we've mentioned that it's mostly family history. So children with any infections in utero. So sometimes certain infections in utero can affect the pancreas development, and then affect the particular cells that produce the insulin. And as a result, children will have no insulin or very little insulin to actually meet the body requirements.
Right.
But also things like cancer of the pancreas. We mentioned that sometimes children will have hereditary conditions where they actually it's familial, where the family will just have this medical condition of type 1 diabetes.
Absolutely. Thank you so much for your time, Dr. Mhlongo. It's always lovely chatting with you. What is your take-home message to mothers that actually have kids that have been diagnosed with type 1 diabetes?
So importantly, like I said, that, mom never actually feel alone or feel like, you have to struggle alone. Diabetes is a team management. And as I've mentioned that, unfortunately, most of our cultures, especially mothers, we are very involved with food. We are so in charge of the kitchen. But when it comes to a child with type 1 diabetes, it's very important to go to a professional, your dietitian, because even with the best insulin, which is for the treatment of diabetes type 1, you still have to have a proper diet in order for that child to grow and have proper sugar control. And the most important thing is we want to prevent complications of diabetes, which are irreversible.
Absolutely.
Yeah.
Thank you so much. So I think to wrap it up, so important to control the eating. Everything happens from there, and of course lifestyle changes. Thank you so much once again for your time. It's been absolutely enlightening discussing this, and it helped my awareness on so many levels. And to the mums out there that do have children diagnosed with type 1 diabetes, Allah shall make it easy for you. Dr. Mhlongo will connect with you again, and thank you so much for making the time to come into the studio for this segment. Until then.
Yes, it's always a pleasure, and bye to the listeners.
Fantastic. Thank you so much. Bye for now.